Hello, I am Dr. Artie and I will give you useful advice during conception attempts. It is well known that the appropriate period for conception is ovulation. With it, the so-called dominant follicle ruptures and releases an egg ready to be fertilized. Ovulation lasts about 24 to 48 hours. There are various possibilities for detecting ovulation, but the ultrasound monitoring remains as standard. However, there is a formula by which every woman and couple can roughly determine the day of ovulation. This is done by taking the date of the first day of the last regular menstruation and adding to it the average duration of a woman's cycle. 14 days are subtracted from the result, and the approximate date of ovulation is obtained. Example: first day of last regular menstruation, 1st of August 2022. Average cycle duration, 28 days. 1st of August 2022 plus 28 days equals 29th of August 2022 minus 14 days equals 15th of August 2022. The released egg is viable for about 24 hours, during which sperm must reach it. Sperms, on the other hand, have an average viability of between 3 and 5 days, which means that the best days to plan attempts to conceive are just before ovulation and on the day itself. However, a period of about 9 days can be considered as a possible fertile window, or the days when the couple is most likely to become pregnant, including 5 days before the expected day of ovulation, the day of ovulation, and 3 days after the expected day of ovulation, because it may not be correctly predicted. It should be borne in mind that the best concentration of quality and mature sperm is obtained at 3 to 5 days of sexual abstinence. For this reason, it is recommended that sexual intercourse in the specified fertile window is not every day, but every other day. Many women wonder when they should take their pregnancy test. A blood test for pregnancy, which is performed in a medical institution or laboratory, gives reliable results about 10 days after the expected date of conception. A home urine test can detect pregnancy about 14 days after the expected date of conception. Confirmation of clinical pregnancy is done by ultrasound examination to detect heartbeat. It is recommended that this examination be performed at 6 weeks of gestation. The practice of reproductive specialists from the medical complex Dr. Starev shows that the chance of pregnancy under normal conditions is about 20 to 25% within a month, 1 monthly cycle. By the 3rd month after the start of active attempts to conceive, approximately 50% of couples become pregnant, while in the next 3 months the chance increases by only another 25%. Consult a specialist if you have some of the following symptoms: lack of menstruation for a period longer than 3 months, irregular menstrual cycle, 2 or more abortions, spontaneous or optional, the woman is more than 35 years old, past sexually transmitted infections, the absence of pregnancy lasts more than 12 months in active attempts to conceive during and around ovulation. Accurate diagnosis of the causes of problematic pregnancies is the basis for successful treatment.